Hernias are a pretty common medical condition. About 1 million repair surgeries happen each year, and that doesn't count the people who choose just to live with them.
A hernia basically happens when internal organs push through weak spots or holes in the abdominal muscle or tissue.
But the big question is how serious is this condition? Morning anchor and health reporter Kirsten O'Connor is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
And because they're so common, hernias, of course, it can be easy to forget that in some cases they can be pretty serious, so it's important to recognize the symptoms. I have Dr. Luke Elms here with me, a general surgeon at Orlando Health, Dr. P. Phillips Hospital. Thank you for taking some time out of your busy schedule.
Yeah, thanks for having me.
So let's start off by talking about how common hernias really are. I think people have this misconception that it's just something that you would identify as a teenager or something during a routine physical, but this is something that you see all the time.
Right, you know, hernias cross all age gaps, they cross both genders, and they really occur much more frequently than people realize because not all hernias are symptomatic, but they all can become symptomatic, and so it's important to know if you have one. Then up to 5 million Americans are actually living with a hernia currently.
Wow, and so what are some of those symptoms that people should look out for?
Well, I think the most common symptom that people realize is they may see a bulge that wasn't there before. Sometimes it's around the belly button, sometimes it's in the groin, the two most common areas to notice that. But another symptom would be just a dull ache or a pain, or maybe in more emergent situations, people may notice that they're unable to have a bowel movement or start experiencing severe pain or nausea and vomiting.
And so for somebody who starts to think, oh, maybe this is what I'm dealing with, what does it look like when you go and you see a doctor like yourself and you do get a hernia identified?
Well, the first thing that we're going to do is we're going to, talk to people about what symptoms they are experiencing because that's important. And then we will do the examination that most people know about. We'll examine their belly button, we'll examine their groin, and try to determine if there's anything that's protruding into a space that it shouldn't be.
Mm-hmm. And so what are some of the risk factors? I mean, I know it could be, you said emergent.
It could be. The main risk factors are going to be, things that cause you to strain. So if someone has a chronic cough, or if somebody is doing heavy lifting with their job, or maybe they have a hernia that was there from birth and is just getting larger over time. But really and truly, another one of the main factors that we're seeing now is obesity really does increase your risk of hernias because it's really anything that increases the pressure within your abdominal cavity can help cause a hernia to get larger.
And you said that this spans all age ranges. So can children be born with them?
Yes, absolutely. Umbilical hernias are one of the more common hernias that children are born with, and many of those will close by the time they reach the age of 5 or so because hernias a lot of times protrude through spaces that are supposed to be there. The umbilical cord attaches to your belly button, and that needs to have a hole there for the blood vessels to pass through. But if it doesn't close like it's supposed to, that's when a hernia can become a problem. But inguinal hernias can occur in children as well.
And you said that the ladies at the desk said there about 1 million people are dealing with this, and there are surgeries happening all the time. Are these surgeries covered by insurance?
Absolutely. Yeah, the hernia surgery is covered by insurance, and it's covered in both the elective setting when it's not an emergency and then absolutely in the emergent setting.
And why is it so important for people to make sure that they're getting the right surgery and they're doing it at the right time? You were talking a little bit about women who want to have another pregnancy.
Well, hernias need to be addressed in the elective setting if possible because there are numerous ways to fix hernias, and when you have an emergent setting fix, it can sometimes limit our options to a less than ideal repair. Females who get pregnant many times will notice an umbilical hernia at the belly button that there needs to be a discussion with the physician regarding their plans for future pregnancies because it does increase your risk of a hernia coming back. It also increases your risk of pain if mesh is used as the pregnancy progresses because the belly wall does expand as the baby grows, but the mesh does not.
And so is that something that could cause problems for future pregnancies?
It doesn't. It's not dangerous. It can just cause it to be more uncomfortable, and in the 3rd trimester, it's pretty uncomfortable anyway.
You're not kidding. I know all about that. Well, thank you so much, Dr. Elm. It's really nice to talk with you about this topic that is obviously impacting so many people.
All right. Thanks for having me.